So what do you teach students or juniors? What do you teach them is their kind of key roles as a physiotherapist looking after someone with a severe brain injury in intensive care? How would you tell them these are kind of your main jobs?
Basically, is first and foremost is always chest physio, so making sure that we're keeping the chest clear, because up until the point you withdraw treatment, your aim is to make sure that that patient's chest isn't going to be what kills them.
And a lot of cases it is.
Yeah, so chest physio is first and foremost as a treatment as a physio for these patients, and then is maintaining range of movement in the early days, so just making sure that patients aren't getting stiff, contracted and things. We're quite a proactive unit in terms of early rehab, so if the decision's made we are carrying on with active treatment, then at that stage we quite often sitting people out of bed and trying to we'll hoist patients into a chair, even if it's a very supportive chair, we'll tilt table early on. So we're moving away a little bit from chest physio, but what you do find is that cohort of patients does tend to become very productive very quickly. So even if there's no...
Why is that?
I don't know. It's just, we used to find it with the heads.
Yeah, the heads always get
all the
really
head injuries within 72
horrifically
hours, they'll always get bad chest, and it's always a very productive, purulent chest as well. It's always a nasty chest infection.
I think it's because they don't protect their airways well enough. So whereas with us, we'll kind of clear our throat or cough or do things that spontaneously, because they've got a dampened cough reflex, it means that anything that drips down from their throat and from their mouths just goes straight down into their chest, and they tend to have poor oral care, so they tend to have quite a lot of manky mouths and things, and that's all just dripping down into their lungs on a constant level. So I think it's almost like a persistent silent aspiration over a long period of time. So I just think it just reinfects it, and because they're not coughing, clearing, moving, doing things, it's just we know how important rehab is, we know how important it is to get up and move, which is why there's big emphasis on getting people up and going early, and these patients aren't up and going, lying down and not protecting their airway particularly well. So I think it's probably a combination.
So flat, so they are flat because of their injury.
Mm.